October is ADHD Awareness and Sensory Awareness Month, and today we're here with Melissa Idelson, the Director of Child Success Center in Santa Monica, California, to get some insights from her on the relation of these two things and children and today's Zoom learning. Hi, Melissa.
Hi. Thanks for taking the time out to share this information together with me today. So it's wonderful that we have a month that's devoted to awareness for children that struggle with attention and also for sensory processing. I think it's really important to understand how those two areas of challenge support each other and can hinder a child's functional success in the jobs of childhood, which is learning how to play and learning how to learn and think and socialize and be part of a community, whether that's their home community and hopefully in the months to come, a school-based community. But for right now, it is definitely a community that is more virtual online. So the first thing we're going to talk about is this big term of attention deficit. Let's talk about there are some children that struggle with attention that may have a formal diagnosis and they may not. People around them might just see that they're really struggling to focus, attend, or to sit still and keep their body in whole body listening, focused in attention. They could also be struggling to keep their thoughts focused and attending, to follow directions and to remember stories that they hear and to remember what they need to do through that auditory system. So that covers the many aspects of attention, which I think is usually pretty easy for parents and educators to see when a child is struggling with attention. Let's talk about the other side of the coin for the Sensory Awareness Month. So the sensory systems aren't always so obvious to pinpoint. And sometimes when children are struggling with sensory processing or sensory integration, we often mainly see the byproduct of the challenge, which is behavior. And one of the behaviors that we see very common is children that have dysregulation. Big emotions, big feelings, trouble playing together, sharing, turn taking, difficulty sitting in this COVID time in a seat and using their eyes and their ears and their thinking brain to do what is expected of them. During COVID, there's very little to no kinesthetic learning. So the sensory systems that have to be front forward and strong and efficient for online learning are the visual systems, the auditory language systems, the executive function systems that use all of that sensory processing, and the ability to sit upright for quite a long period of time. As most of us have seen, if we've gone more to Zoom-based work, that it is very hard for our bodies to sit still and to sit upright purely physiologically. So when I ask parents about sensory processing and attention with their child, here are some of the questions that I'll ask them. Kind of like looking at your checklists. So the first thing I'll ask them is, how was their child's development in those first 3 years? Did they meet their milestones for tummy time, for crawling, for sitting, for standing, for jumping, for climbing, for moving? And how safe and efficient are they in their body? That tells us a lot about kids getting their feet on the ground or their bottom in the seat, staying upright and together. The next thing I'll ask them about is their breathing. So I want to know, are they good sleepers? Do they breathe with their mouth? When they breathe at night, is their mouth open or closed? So our resting mouth posture tells us a lot about how we're oxygenating our brain. We don't really get good breath control and oxygenation if we're not doing nasal breathing. These little things are important when we see attention challenges in children. So attention challenges, you know, as an adult, your physical being needs to feel rejuvenated from a good night's sleep. and your brain needs to be alert from a good night's sleep, and your physical being needs to feel strong and successful to sit up and learn. So all of those things are related to how we process sensory information and how that information comes out in sensory motor activities.
Melissa, how can occupational therapy addressing sensory processing challenges help children with attention challenges?
So the world of occupational therapy does address, in the medical arena, children that have delays with motor skills. So the gross motor skills, which is balance and coordination, children that struggle with clumsiness, sitting upright in circle time, participating with their body in the job of childhood and self-care. In a holistic model, an occupational therapist's job is to look at the job of childhood, and that's different from a 6-month-old to a 3-year-old to a 7-year-old to a middle schooler. That job of childhood relies upon our brain as a computer system to work efficiently to do those jobs. So an occupational therapist is trained how to task analyze, how to break down a task. So when a parent calls me, and they're calling usually because of behavior or difficulties with certain skills, what my job as an occupational therapist to do is to task analyze what did that child's sensory motor systems, social emotional systems, organizational systems, regulatory systems, what do those neurological systems need to do to efficiently do those jobs? And there's usually a storyline in there. And as an occupational therapist, I've been working with children for 30 years, so I've assessed many, many hundreds of children. And you see the same types of challenges. Sometimes children have difficulty with what we call modulation. That information that comes in through our muscles and joints and balance systems, our eyes, our ears, our smell, our taste, our touch, all of those sensory systems, sometimes kids get flooded. And when they get flooded with too much information, they get goofy and silly or frustrated and angry, or they give up or they avoid. All the behaviors are behaviors to compensate because they're not able to do the jobs that we're asking them to do. And eventually that hits heavily on self-concept and self-worth. And an occupational therapist is trained to use their therapeutic use of self to get underneath the child in a strong, supportive relationship, like a cheerleader. And then our job through our neurological training is to know how to create a pathway to get to where we're going for successful outcome measures, successful function, and to cheerlead that child and make sure that the challenges are only what we call the just right challenge. It's a challenge that the child is always going to be successful, but is always going to take them one step further. So it's a small, mild challenge rather than what life is usually offering them, which are some bigger challenges. And if they smell failure, if they sense failure, if they smell that it's just going to be too hard, if their eyes look at something and it looks too hard, looks too much, it's not fun. And children learn through joy and through fun, and they will avoid things that are the opposite.
Great approach, Melissa. Question, do all children with attention challenges also have sensory processing challenges?
So we see there's a word that we use, it's called comorbidity. It means that things link and go together. Sometimes when we work with children, we work with them from multiple perspectives. Okay, so it doesn't always go together, but it's very, very important that any child who is struggling with attention should be assessed by an occupational therapist that is skilled and experienced in sensory processing, and also skilled and experienced in working with children, not just with a medical diagnosis, but also typical learning challenges, because they often go hand in hand. When children struggle with attention, they might actually have a processing challenge that's affecting learning, or they might just be missing pieces of learning because they struggle with focus and attention. So
Okay.
in that answer, it would be, if I had my choices with children, and a neuropsychological person who does assessment, who I work with, said to me, every child that shows any type of challenges should be seen by an experienced sensory processing therapist.